Okay, go ahead.
Hi, I'm Maya Merheb, a gastroenterologist here in Medina.
So we are in the process of hearing the woman's voice in medicine. So, what can you just kind of give us a feel for why you chose Medina, how long you've been practicing in Medina, and so we'll start there.
Sure. I've been here it'll be 14 years in July, so 13 and a half years. And it feels like 2 years, to be perfectly honest. And honestly, there was the sense of a community hospital with a lot of need for gastroenterology. It's one of those things where there's multiple factors, but I felt like it was good collaboration with multiple other specialties, the surgeons and the anesthesia providers. And it was kind of a place where you can say, I can be here for a while. And luckily I was right on. It wasn't an easy decision. I knew I wanted to be somewhere in the Cleveland area, and I interviewed in a lot of places, but there was something about it that drew me, the need, the importance of the work that needed to be done. And I have to say I was very happy with my choice, and I still am.
Wonderful to hear.
Yeah.
So we've been focusing really a lot on the changes that physicians have seen, both in Medina Hospital since you've started practice, and even in your specialty. Can you kind of tell us what maybe your experience has been?
Actually, sometimes change is painful, but I think in the long run it's helpful. We've come a long way with, better technology, better advancements, better electronic medical records. But I think there's such a high burnout with the administrative part for us physicians, the documentation, the prior authorizations, the insurance companies. So we try to focus on why we're there, the importance of patient care, and try not to let that get in the way sometimes. The future is also something, to be determined with AI in medicine, robots in the OR, where will we be? But I think we focus on the reason we chose medicine, which is to help others and make a difference in their lives. And we kind of take change with stride, one day at a time. Or else I think you drive yourself crazy.
I would agree. Do you have any special moments in your practice that really mean a lot to you?
I think it's really the people and the patients. I came into Medina Hospital a fresh graduate out of residency and fellowship. That was my first job. And I think the way the nurses embraced me in the endo center and on the floors, I got the chills. I mean, it's still one of those moments where you just don't know who you're going to get to work with, how you'll be treated. And I felt like they took me in as a daughter, from the floors to the OR staff. And, the relationships, are wonderful. They're lifelong friendships with fellow colleagues, and especially the nurses, the techs. They take care of us. They really take good care of us. And that's why we're able to take care of people and make a difference in their lives. So one of the best moments as a doctor is just hearing a patient somewhere where you least expect it, at a big gathering at St. Ignatius High School dinner, and she's telling people that person right there, she saved my life. Those are the moments that we sweat for and we work hard for, but those are the ones that you never forget.
So we've focused a lot on change, and as you've mentioned already, there's been a tremendous amount of change. What do you think is the best change in medicine to date?
I think the advancements in technology, the fact that we can diagnose quicker, we have a lot of resources to utilize, we have a lot of subspecialties even now too. Getting the patient to the right hands is very important. I feel like we have less limitations where, we're trying to reach the diagnosis quicker, and we know how to get that patient we can navigate the system better with collaboration and just making sure they get seen by the right person as soon as possible.
And you've mentioned a lot of really positive changes. Are there any changes that have saddened you to date?
I don't think it was change. I think the whole COVID era saddened me. I think But I think some good things came out of it. I think we've become busier as a community here. I think we're drawing from a lot of the communities surrounding Medina. We're not just taking care of people in Medina anymore. So I think it opened up various things. We're seeing a lot more pathology that we hadn't seen. So we always kind of try to see what's the bright side. And I think the bright side is, just exposure to more things and being able to help more people.
And I know you're relatively new in medicine and your practice, but is there any really good advice that you could give to physicians who are just starting out?
Yeah, definitely just remembering why you went into medicine. There's definitely easier routes and different ways, but I think the question of whether you do it again, and if the answer is yes, that's how it should be, because you have to enjoy what you're doing. You're spending more time at work than you are at home. So, remembering the reason, what is your why, the compassion that drove you to it, the calling. I think that's the most important thing to remember in the in the hardest moments.
And as a woman physician, is there any advice you would give to young women who are joining them?
Oh, yeah. I mean, I'm in one of the specialties that's definitely underrepresented by women. And I think people look at you like, why did you even choose this? But I say, when there's a will, there's a way. If this is really what you want to do, you'll find a way. Yes, it's not easy to have children during medical school or residency or after, but I think you always focus on what's important and what's going to make you happy. And I think it's very doable. And I do it again.
So glad to hear that. So, for the future, particularly in Medina County, do you see anything coming in the future for Medina County?
I think continued growth. I think Medina has really welcomed a lot from various aspects. For a new president recently with a great mindset, we did get to meet with him, and he's got a lot of good plans for the hospital. They've been drawing a lot of subspecialties that we didn't have before. The orthopedic department, we're getting a lot of newer graduates that are, that have offered a lot more to the patient, to the population, and we're really serving a large amount of people.
It is so good to hear all of that. In summary, are there any other thoughts you would like to share with those who will be viewing our history of medicine in Medina County?
I honestly think Medina is a wonderful community hospital. It's not limited by a lot of restraints. We get the job done. The patient gets great care. I was always also very happy with the radiology department. In my previous trainings, we didn't get the readings as quickly as we did here. The social workers, I think the people here do really care. That's why they're in Medina. I think we all have choices, but they made the choice to be at Medina for various reasons, and the personalities and the collaboration go a long way.
Any other thoughts?
The future is ours, and we'll see how things go. It's a matter of time.
Thank you so much for your time, Dr.
Sure.